Our quorum call the meeting to order, and our prayer this morning is going to be led by Pastor Rick Felton.
Pray, please. Heavenly Father, we thank you for this day. Lord, we're grateful for our county and the resources that we have. Lord, I want to say thank you for those who work every day on our behalf, from the commissioners to our law enforcement, other first responders, health department, just everybody that stands up for us. Lord, as we continue in this pandemic, Lord, I continue to ask for healing for those who are suffering right now. Lord, we ask that this disease be eradicated, and we thank you for everybody's working so hard to make that happen. Lord, I ask you to be with the commissioners this morning as they work to make the decisions that are the best for this county. In Jesus' name, amen.
Amen. Thank you, Rick. Good to see you. Item number 3 is citizens' comments. I don't have anyone signed up to speak in the last minute. All right, so we'll move on to item number 4, consideration and approval of minutes from January 25th, 2021. You got those electronically?
I move to approve the minutes from January 25, presented by the county clerk.
Okay, we have a motion from Commissioner Worley, a second from Commissioner Truitt. Any further discussion? All in favor? Carries unanimously. Thank you. Item number 5, consideration and approval of any treasurer or auditor's reports as needed. Do we have any?
Not today.
Not today. All right, item number 6 we'll come back to. Item number 7 is our consent agenda. Item number 7A is Commissioner Kelton. Consideration and possible approval of action regarding the burn ban.
I would like to see us consider putting it back in place.
Looks like we have a consensus. I'll need a motion.
I think we dodged a bullet barely on that one the other day, but that wind short bad. And you're saying a low wind forecast for this coming week, is that correct?
What I understand.
People got stuff they need to find.
Yeah, we get a good wind there.
Get back on the brain.
Maybe knows it.
Would you like to make the motion?
I'll make a motion that we, first we have to find the conditions caused that we, conditions are warranted that we, whereas the Commissioners Court finds the circumstances present in all or part of the unincorporated areas of the county create a public safety hazard that would be exacerbated by outdoor burning. Let me read the rest of it. It is hereby ordered by the Commissioners Court of Brown County that all outdoor burning is prohibited in an unincorporated area of the county for 90 days from the date of the adoption of this order unless the restrictions are terminated earlier. Based on the determination made by the Texas Forest Service or this court based upon determination that the circumstances required, the order no longer exists. This order is adopted pursuant to the local government code 352.081 and other applicable statutes. The order does not prohibit outdoor burning activity related to public health and safety that are authorized by the Texas Commission on Environmental Quality for firefighter training, public utility natural gas pipeline or mining operations, planting or harvesting of agricultural crops, or burns that are conducted by prescribed burn managers certified under 153.048 of the Natural Resources Code, and meet the standards of 153.047 of the Natural Resources Code. In accordance with local government code 352.081, is a violation of this order is a class C misdemeanor punishable by fine not to exceed $500. I make a motion that we reinstate the burn ban until further notice for 90 days.
Here we have a motion by Commissioner Kelton, a second by Commissioner Truitt. Do we have any further discussion on the burn ban? All in favor? All right. Upon the signature, the burn ban will be reinstated in Brown County until further notice, or at least 90 days unless terminated early. All right, well, that's coming around. Item number 7B is Lisa, you got that? Is Lisa Dick, Administrator for Brown County Health Department. She's going to give us an update on the COVID-19 response and county health initiatives, and I think, fingers crossed, she might be bringing us some good news this morning. Cautionary good news.
I think I am, but we have 387 active cases in our county right now. Last week there were, I'm going to just check my number right here, but there were 184 new cases in our county, and that's a little bit down from before, but we're not doing as well as we were at the beginning of November. So that part of it does look promising. In addition to that, we are receiving 600 vaccines through the hospital. And so Hendrick, Brownwood, and the health department are combining forces, and we will be having a drive-through for 600 doses on Wednesday. And so what we'll be doing is we'll be taking the people that signed up on the county list, the Brown County Health Department list. And so we'll be sending out information to those that meet the qualifications and down to the 600-ish people. So,
Now, will they receive a robocall or an actual call? That's the question I get every day.
so it will be an email is what we will be doing. So people need to watch their emails. There are a few people, not many, that just didn't have emails or didn't have someone that could help them with email. And so we will be also contacting those people directly. So that is going to be a process for us. So the hospital has also agreed that we will work off of the same list, and so they will be referring people to the Brown County list, and so that will be a concerted effort with both groups together, and we will be offering that same opportunity to other providers that may be receiving vaccine. They are welcome to work off of our list. It makes things more organized and simple if we only have one list versus people having to go to multiple sites to sign up. So that's open for any of those providers that want to do that. They can contact me. We've also been working on trying to become a hub. Right now, the state says that they're not adding any additional hubs, but we did have confirmation that the group that instated the hubs knows and is very aware that we want to be a hub, and they will have us into consideration. So it may not be the answer that we want, but I think it's an answer in the right direction. I don't care if we're a hub as long as we are receiving vaccine to provide to our community.
I will tell you that if I can jump in,
Sure.
Lisa knows this, I've spoken directly to Congressman Fluger, his chief of staff, the governor, his chief of staff, Nim Kidd, our state emergency management director. They all say we are at the tip top of the list to become a hub when they add another. So there's really that we've done everything humanly possible.
I think that successfully completing this Wednesday's drive-through vaccination clinic will help contribute to our ability to do that. Before, we've just been telling them we can handle this, and this will be a showing that we can do it.
Who's going to be administering the drive-through? Is that going to be?
It is a combined effort. So it's going to be our response team that has been meeting weekly along with Hendrick.
Where are we doing it?
I'm sorry, where? It will be at Gordon Wood.
I just want to make sure everyone hears.
Yes, but if you do not have an appointment, do not show up at the clinic. We're doing those by appointment so that people don't have to wait in line as long. We're doing them by appointment, and we're basing that on the criteria of you're meeting the 1A or 1B criteria set by DSHS. And then by the time that you signed up. So if you don't have an appointment, then it's not your turn to get a vaccine yet. That doesn't mean that there's not someone else on the vaccine list that doesn't have similar situations to you. It may mean that they signed up a little bit earlier. So we're trying to do this in the fairest, most organized way that we can.
So what is the age group you're doing this month?
So we'll still have some of that first group, 1A, so first responders that we'll be contacting that are on our sign-up list. And so our age group is the 65 and above. And then we're also looking at the 65 and above that have health conditions. And so our list is so large that it's over, or it's close to 4,000 people at this point. So over 3,700. And so and that was on Friday that those numbers come from. So we're only taking right under 600 people to do that with. So that is a big chunk, but not nearly everybody that's on the list.
Lisa, in that 1A group, are elected officials in that group?
So that has been some just different opinions on what that looks like.
I'm just asking. I can't take it for a while anyway, but
So
I'm just asking.
And so we are looking at making sure that we are taking those people that have face-to-face interaction with others every day.
According to Governor Abbott's office, essential government workers are in Group 1A.
I know you got your office all
Yes.
inoculated, but failed to mention it to the other elected officials.
We had them under emergency management, Group 1A first responders, yes. And Darrell got his as well. But yes, and we've actually started a list. Stephanie's working on it in the courthouse of any elected officials and their staff that would like to be vaccinated. Because the government has to stay operating, and we have face-to-face contact every day. Told us that the public as well, but we have to have an essential government operating. So we're told that they're in Group 1A, but since Commissioner Worley brought it up, we've installed protective barriers in basically every office that has face-to-face contact. And also the public, we made it the courthouse as safe as we possibly can to come in. So I hope that no one fears that. Plus, we limit the number of people in the building, visitors in the building at a time. We have been for quite some time now. So we're taking every precaution possible. And of course, we want to keep the government up and operating, especially the Office of Emergency Management. I see Chief Johnston back there, so we're good to go. And how we did that, just for the record, since Commissioner Worley brought it up, the hospital CEO called us and said, we finished everyone in Group 1A that has signed up for a vaccine, and we have 30 left. Would you like to have emergency management done? So I took the emergency management team when we went over and had it done, and still that's only 4 people, so we still had, I don't know where the rest of that was on January 5th, so I don't know where the rest went, but anytime we have extras left over, as Lisa will tell you, they're not gonna go to waste, we're gonna make sure we get them.
We will not let those go to waste. And I will make a clarification on, so the DSHS, Department of State Health Services, their guidelines are the guidelines that we're going by. And because there are other guidelines out there, CDC initially set guidelines and then each state could determine the guidelines that they're gonna use, so that there's a slight difference in those. So if anybody wants to use that as a reference point to see who is on the list, it's the Department of State Health Services for Texas list, not the CDC list that we're going by.
I was also, contacted by Darrell about cones, traffic cones to do the setup for that, and I forgot to look and see how many we had. I know we don't have very many, so y'all get contacted about maybe using cones for setting up the. I forgot to look. I forgot to
Yes, sir.
find
I talked to 3 of the 4 foremen or commissioners. We have about 50 countywide that we can get, and contacted TxDOT. We're gonna get 100 from TxDOT.
Oh,
It'll be good for this round.
well, I'm sure we have a few, but I know we didn't have many. I forgot to count them. I was going to tell you that this morning, so.
There's a bunch out there. Who are those? So if you go for I go
And
for Texas.
I think they belong to the company. I may be mistaken, but that's what I'm thinking.
I know he's contemplating, before we move on, will you be contacting Chief Katie, or do I need to ask the sheriff to have a deputy? I know we need to have someone out there with you on.
So, we have a meeting at 10, and then we will get all of that kind of stuff lined out. Darrell will be there also.
So has the email been sent out to who's gonna get the 600?
That will be done, today. So there's part of that that's a screening component, and so we don't want to do it too far in advance, or we would be rescreening our individuals. And so we do need to get the word out that if you signed up on the list, please watch your email, and you should receive those today. If there are email addresses that don't work, or if you didn't have an email, then we will contact you another way.
And as a contributing positive, I've had several nurses I ran into over the weekend, just when I was out checking them out, and they had initially not taken the vaccine, and now they've decided that they have enough confidence in it that they now want to take it. So I think we're definitely moving in the right direction. If we could just get 3,500 vaccines here, we'd solve our problem, most of them.
And I think that many of the counties in Texas are saying that. I've talked to people from other states, the feeling is the same, that people are wanting the vaccination to get here so that our lives can move a little bit more back to normal. So, and we are continuing with the vaccination clinics, and we are also working on a budget where we would be requesting that the county contribute to part of those expenses that we're incurring. Or we're accruing.
You let us know what you're speaking about as soon as you can, I guess.
Yes.
Do you know what's going on with the nursing home and assisted living?
Yes.
I'm really, really concerned about that.
Okay.
That-
So, most of our nursing facilities here in Brown County have received their first, if not their second dose. There are a couple of them, assisted living facilities, that have not received doses. And so what I think happened is something happened with the contracting that occurred with, pharmaceutical companies where those vaccines, or they are not gonna do those contracts anymore. And so the state has asked the health department to make sure that we connect them with someone else to provide those vaccines, or if that is not possible, then the health department will make sure that they get vaccines. When you look at assisted living and nursing facilities, they certainly have qualified staff to provide those. And so the other option would be to get them signed up as a provider and they could provide their own vaccines. So we are aware of just several that, just a couple in our county that don't have that accomplished yet. And so I'm pretty sure I know the one that you're talking about, but if you want to, I would never want to bring that to light in a public meeting, but if you want to text me or call me later, I can tell you if that's the same one and what we're
I trust
at. Yeah.
The last thing I can add, Lisa, is, still, most people know, but all 254 county judges in the state, by state statute, by state law, are the directors of emergency management for their entire county. So they all, and we all know what all that entails, but that enables me to get some firsthand information. We're hoping it didn't happen last Friday. We're hoping it'll happen this Friday. The Johnson & Johnson vaccine is up for what's called an EUA, emergency use authorization. As soon as that is approved, heaven knows that it is, that will help tremendously, because it's apparently, I'm told on the conference calls, much easier to manufacture, and it's a one-dose shot.
And it's 66% effective of what I've also read, though it's not as effective as the 2 shots on Moderna. What's the other one?
Pfizer. So the Johnson & Johnson, after a period of time, so around 1 month, it's not as effective, but as time passes, then the effectiveness increases.
Well, if the EUA is granted, I'm told that they have just an unbelievable number of those ready to roll out, and so that might help our.
66% is a lot better than no protection. But I'm saying what I was reading, that was only up at this time, they're all figuring it at 66%, if I remember that right.
And that may be the delay in making and releasing it.
Because the national news showed it being higher, and I heard people discussing, I looked it up, but if you look on the websites, it said 66, so I don't know if there's been a little misinformation perhaps about.
Well, yeah, and like Lisa just said, it hadn't been out long enough to, I mean, that's the curveball that we have to try and hit when it comes to this is a lack of a year or 2 year or 10 years worth of studies. But we're in the middle of a pandemic, we have to act. But if that gets approved.
Right,
And,
yes.
Lisa and I communicate several times a week, so if she hears something, she tells me. If I hear something, I tell her, so.
Is the other one gonna be the Moderna, we got coming in the second
Yes,
round, I mean, the
yes.
600?
Yes, sir.
So they're
So-
familiar with using that here, and
Yes, we are. Yes. And so we also had the 100 doses that were given to first responders that were given by the health department, either at the health department or at the depot. The second dose will be available on Thursday from 1 to 4. And so that was a 100-person clinic, so we should be finishing those up, second dose then, so.
Carol, our Chief of Emergency Management, do you have anything you'd like to add?
Just wanted to, kind of clarify with Lisa, if somebody's had COVID and cured, there's not a waiting period, is that correct, for the vaccination?
If they are recovered, then they're eligible to receive the vaccine immediately after recovery. The caveat to that is that depending, if they've received some type of therapies, some type of medication or treatment while they were positive for COVID, then that may delay when they can receive the vaccine.
like the infusions or the human antibody one, or the other one, or the
Yes.
different ones.
Then that would just delay, I think it's 90 days.
Just say, I was told that I couldn't take the vaccine for 90 days.
If you just had and I know this sounds weird, but a regular case and did not receive any of those medications, then you would be eligible right after you recovered. I also would encourage you to listen to your healthcare provider too. So your physician knows what's best for you. There's no way we can review everything whenever you come to a drive-through or an immunization clinic. We don't have access to your health medical chart. And so I would certainly, if you have had COVID and have concerns about that, get approval from your doctor first.
That's all I have. That's just one of the questions we've received.
Yes, we receive that a lot.
And I think one or two people said they wouldn't take it no matter what, but I think most people, that I talked to would like it, would want it. But there are those that are, they're dead set against it.
Yes.
They're not going, they don't want to. So,
We do have around 31,000 people and that we think are eligible in Brown County. And so really what I think that is saying is just people above 16 years old that would be able to, that are eligible to get it right now. And that was an estimate given by the state. And we certainly don't think that we'll get that many vaccines, but just remembering that what makes us return to normal or gets us to that point is herd immunity. And so with a higher level of vaccinations percentage of population, the easier it will be for us to return to that. Thank you all. Anything else?
Thank you. That's good news. We've been looking at you all the time.
Thank you, Commissioner Ward, we all prayed for you when we heard that you were sick. We're glad you're healthy tonight. All right, item number 7C is Commissioner Kelton, discussion again on possible action regarding speed limits on county roads.
Well, this kind of falls on that Shane has had time to look into that.
We're not prepared to move forward on that.
We're gonna put on the agenda again for the next meeting, though. Okay, so I'd like to keep it on the agenda, so maybe next time we'll move on this. Thank you.
All right, so we'll pass on item number 7C. 7D is David, the Sheriff Hill presentation of his racial profiling report that he has to present under statute.
How are y'all this morning?
Good morning, Sheriff.
I'm fixing to throw a bunch of numbers at y'all like I usually do. I know how boring that can be. But this year I did make y'all copies so y'all can follow along. Won't just be looking at me like a student
I never looked at you like that.
as I am. Y'all get one and pass it around. That's not enough.
Anyone?
Everybody get one? As the judge said, I'm required by law to annually present to my governing bodies the statistics on racial profiling in Brown County. That first page there, just looking at, that's the policies and procedures that I'm required to adopt, and we are in compliance with all those regulations there. If y'all see on the top of the third page, we made a total of 678 stops in 2020. I'll let y'all know that that's down nearly 1,100 stops due to the COVID.
When you say stops, is that vehicle or is that foot too?
Traffic stops.
Traffic.
Moving violations are vehicles only. Traffic stops. Out of those 678 stops, 138 was on city streets, 91 was on US highway, 173 was on county road, 235 were on state highway, and 41 were on private property. Did we know the race of the individual prior to the stops? 36 of them, yes, 642, no. Out of those stops, there was 2 Asian or Pacific Islanders, 41 blacks, 514 whites, 121 Hispanics. The gender of those stops, female 223, 1 Asian, 15 blacks, 179 white, and 28 Hispanic. Of the males, there was 455 of them out of those stops. 1 was Asian, 26 black, 335 white, 93 were Hispanic. Reason for the stop, violation of the law, 5 were black, 57 were white, 8 were Hispanic. Pre-existing knowledge in the stops or pretext stops, 12 of those, 10 were white, 2 were Hispanic. 401 stops were for moving traffic violations. Out of those, 1 Asian, 29 black, 296 white, 75 Hispanic. Vehicle traffic violations, 195. There was 1 Asian, 7 black, 151 white, 36 Hispanic. Was search conducted? 76 yes. 4 of those searches were black, 56 were white, 16 were Hispanic. 602 of those traffic stops, there was no search involved. I'm not gonna go through those numbers. Reason for the search, 36 of them were for consent, 2 of those were black, 29 were white, 5 were Hispanic. Contraband in plain sight, basically is what that next one is. The reason for the stop, or search was 10 of those. There was 1 black, 4 whites, 5 Hispanics. Searches due to probable cause were 30, 1 black, 23 white, 6 Hispanic. None for inventory, none incident to arrest. And out of those searches, 76, we did find contraband. Out of the contraband found, there was two blacks, 35 whites, and 9 Hispanics. No was 30, and I'm not going through those numbers. Drugs located 23 times, 19 whites, 4 Hispanics. Weapons found, 1 white. No currency. Alcohol, 11 different cases, 8 were white, 3 were Hispanic. No stolen property. In other categories, it's going to be 11. There was 2 blacks, 7 white, and 2 Hispanics. Results of the stop, out of the 600 and something stops, we did 402 verbal warnings. 1 was to Asian, 24 to black, 311 to white, 66 to Hispanic. Written warnings were 39, 1 black, 29 white, and 9 Hispanic. Citations issued, 194. There was 1 Asian, 16 black, 143 white, 34 Hispanic. No written warnings, no citations / arrests made. Out of those stops, we did make a total of 43 arrests. There was 31 of those white, 12 Hispanic. Arrests based on violation of the penal code, there was 23 of those, 17 white, 6 Hispanic. Violation of traffic law, there was 7 arrests, 6 white, 1 Hispanic. No violations of city ordinance or county resolutions. Outstanding warrants were 13, there was 8 white, 5 Hispanic. And I'm proud to say there was no physical force resulting in bodily injury used during any of them traffic stops. Number of complaints of racial profiling, I'm also proud to say there's 0 of those. So that concludes our report of racial profiling for the year of 2020. And I give Ms. Ferguson a copy to be filed, so please do that. Any questions on that?
They don't require percentages by race, it's just numbers.
Just numbers, which, you know, we're also required to take a look at this departmentally and make sure that there's not any racial profiling. And on the percentages, I didn't bring that stuff, but y'all can clearly see that I feel strongly that there's no issues with racial profiling within the office. So I hope that y'all will concur with that.
It appears to be good. Good.
Appears to follow the population percentage.
Yes.
Actually, it's below.
Yeah.
A lot of
But still,
When they bring
Yeah.
their class.
4 white, you're picking on the 4 white males, it sounds like.
Well, whoever needs it will.
Do we need to formally adopt that?
I think y'all need to formally accept it.
I'll make a motion to accept the presentation of the racial profile report from the sheriff
for the year 2020.
for the year 2020. Okay.
We have a motion from Commissioner Kelton to accept this year's, for the year 2020, racial profiling report, seconded by Commissioner Shaw. Do we have any further discussion? All in favor? Carried unanimously. Item number 7E is also the sheriff consideration and possible action, authorizing the sheriff to accept donations.
I forgot to bring this check last week, it was hiding in my drawer. But this is a check from the Food Plaza Corporation. Tony Mann and Eddie Syra are the owners of the Food Plaza Corporation now. and they donated $1,000 to my office.
Goodness. Please thank them. I'm sure you have, but thank them again.
I move we approve the donations to the sheriff's department.
Second.
Okay, we have a motion by Commissioner Worley, and second by Commissioner Kelton to accept the, or allow the sheriff to accept the donation. Any further discussion? All in favor? Carried unanimously. Thank you, Sheriff.
Thank you, gentlemen, appreciate it.
Item number 7F is, Brandon from Eden Farms, consideration of possible approval of action regarding a new plat for, Brownstone Farm subdivision. Come on up, sir. Yeah, he sent an email out.
Good morning, Commissioners.
Good morning, sir.
This is just a replat. I think this was approved. I just drew a blank. I was trying to get the answer. I think it was in August of 2020. The original plat we went to get water meters set on the properties, and we had to do some adjusting based off of what Brooke Smith was allowing us to do. And so initially we had to adjust to have access to each lot off of the US highway there. And so that's basically what we did, is just amended and replatted it for water meter purposes only.
I've got a question for Shane. Since we accepted that first plat, how do we negate it and replace it with this one?
This does.
Is this an amendment or is this how do you work?
This is a replat.
This is a replat, okay.
But we don't have to negate the first one?
No.
Okay. Because nothing was done on it.
Right.
It's in your precinct, right?
That's right.
Where is this? I can't think of this.
Where County Road 225 comes into 377 between the Brooke Smith turnoff and Winchell on the south side of the road.
Okay. So it's
Kind of makes sense. where
yeah,
it's at.
so it's on 377.
Yes,
Gas fronted, yes, sir.
it fronts 377 and County Road 225.
And Brooke Smith sent after we were platted, was that they wanted our meters all be on 377.
And that was because they could only deliver water to the specified PSI off of 377. It went down 225, the elevation went up, and the water pressure got down.
It was,
But they could deliver the pressure to 377.
it was just a play on different elevations based on where their current water system was.
That would require them to boost the pressure just for that, and it's probably not for them, it would be worth it.
Yeah.
I understand, different plant elevations.
That's it, that's all I have.
Do you have the plat with you?
I have, 3 copies. I can pass them around.
No, you have the Mylar copies?
No, it's, I was told that we just need to get approval, and then I'll submit the Mylars. Yes,
Have to sign the Mylar, right?
yes, yes.
So, we approve this plat, and then you bring the Mylars back? Is that
Yes,
what you-
yes, sir.
Yep. Is that your intention?
Yes, sir. From what I understand, I just need to submit the Mylar to the office for signatures, is that correct? Or do I need to do this?
They need to be signatures.
Well,
Do I need to be on the agenda again?
The judge, no, you just have to bring it to the judge.
Yeah.
You don't have to come back to court.
Yeah.
They're gonna
Submit it to us. I don't remember how many copies. Tiana, do you know how many?
Usually three, isn't there?
Three?
I think it's 3.
Three copies.
Yes, sir. Need
I
me-
move we approve the replat of, what is it, Brandon?
Brownstone.
Brownstone Farm subdivision.
Yes.
We have a motion and a second. Motion by Commissioner Wood, second by Commissioner Shaw. Any further discussion? All in favor? Carried unanimously. Thank you, sir. You'll get those to me, I'll sign them the same day.
Perfect, thank you.
Item number, we'll go back up, item number 6, consideration of possible approval of payment of bills needed. You got that?
Thank you.
Perfect. Okay.
It's already gone that way.
I didn't get it.
Very much.
You sent it since February.
You had it.
I did tell you.
You have it.
All right, Sharon, hold that up a little bit.
I usually don't get things, so. That's funny.
That's why I haven't yet.
You ready? I'll make a motion to approve the bills presented by the auditor.
Okay, we have a motion from Commissioner Kelton to pay the bills, seconded by Commissioner Truitt. Do we have any further discussion? All in favor? Motion carries. And lastly, item number 8, Commissioner's comments, no action can be taken on anything during this information only discussion.
Shane, did you have a chance to look at all of that, or
I did
road
not.
speeds, or where are we at on that?
I did not.
Oh, you did not. You think we'll have time before the next meeting?
Yes, I did.
We had a notice in Brownwood Bulletin yesterday that we will consider, let's see, for a public hearing to consider and act on resolutions to confirm Grant County, Texas is eligible to participate in tax abatement. 2, consider and take possible action to adopt criteria and guidelines for tax abatement. Like I said, we had it in the paper yesterday, so we will be putting it on the agenda for Monday, February 8th, to consider those criteria and guidelines.
I have an announcement to give to you. Matt isn't in here, but we're having an upgrade in technology, I'm excited to say, kind of emulating what the city will have done. In the next week or two, you'll have at your post from now on a tablet, which will have the agenda and all the attachments and everything on it, so you can have it digitally, you can access your email. When you come in and sit down, all you'll have to do, Stephanie will already log you on. All you have to do is, if you want to read your email, type in your password, pull it up. But the key to it is, on the days that Lisa can't be here, particularly under COVID, it will have all the statistics from the previous week, the projected vaccines that we're going to receive for the weekend, the coming week, the Monday that we're meeting. And all the pertinent data. You can share that to your phone. You can have it with you out in the field. You can forward it to anyone you want. Anyway, our COVID money paid for it. We got a fantastic deal. It wasn't even $1,000 to equip everyone, including Tiana, everybody here, including the county attorney, everyone will have one at your station. So you'll have digital, and also the plats can be uploaded electronically, so you can see a color version digitally right in front of you. It's touchscreen, there's no keyboard to get in the way, so you just use your finger to move it. If you'd like to see what it's gonna look like, the city recently has that in place. And of course, it was zero cost to the taxpayers here, so.
You probably have a display like the next week's weather forecast for fire, I guess, for talking about fire.
You can do it, it'll give you a fire, Daryl can send you information and pictures, and he can even actually send to each of your tablet a picture of a fire that we had. So, but anyway, that will be forthcoming. They've been ordered. I think they're due in today or tomorrow. Matt will set them all up. Again, all you'll do is walk in from Sharon all the way around. You're already logged on. All you have to do is sit down and touch the screen and do what you want with it. So that will help us a great deal. Plus, it'll help save paper and ultimately cut down on, now, there are lots of things we're still gonna have to sign that we passed around. By the way, we want to hear terminal also. Anybody have anything else to know?
Who keeps up with them?
So Stephanie's gonna manage turning them on and off and all, and
Who
Are they
keeps,
stay, they man them?
oh, they're in a little leather case that just sits on the tabletop.
who keeps them?
Yeah, so they.
Because they're not gonna stay in here all the time, right?
Yes, the door's locked all the time.
Because.
You can take it in the field if you
No,
want.
no. This room is used for a lot of other things. I'm wondering why they would stay in here.
Well, it's entirely up to you. You can take them with you in the field. The room is only unlocked when the deputies let someone in here. So I'm not really secure or worried about them walking off.
They use these for.
and-
That's what I'm,
Well, we look over there, right,
I mean,
Stephanie can collect them after each meeting and keep them in her office if she wants. I'm just trying to make it as easy as possible for everyone. You can take it with you. It's yours.
Then you gotta remember to bring it back.
But if you leave them here, then like I said, when you sit down, you don't have to do a single thing but touch the screen and what you need comes up. So we're just trying to make it as simple as possible, and ultimately it will save us in lots of paper production. Now, that'll take a long time, but ultimately it will.
I'll say right now, I'd probably leave mine here or.
The only people that I know, the deputies usually let us know when they unlock the door and let someone in here. Every now and then CPS court uses it,
Right.
But not lately.
We're all Zoom.
Yeah, we're all Zoom, so I don't foresee a problem. But again, if you want to take it out in the field with you, because it also can take photographs. If there's a photograph of a road or something that you want, you can take a photograph, bring it back and share it. So, it will help us, get into the current century. All right. Anybody have anything else we need to discuss when we're gonna meet again? Today's the first, of course, do we need to meet on the 8th? Jennifer?
Yes.
okay, this is scheduled.
So a regular meeting, on January 8th at 9 a.m. Sorry? What did I say? Oh, I'm looking at January, sorry, February, I'll tear them. So February 8th at 9 a.m. With that, we are adjourned.